Hi, I'm Toby Shapshak, and you are listening to the Stuff podcast. We like to speak to interesting people about interesting things, and Saul Kornik is a very interesting entrepreneur who has created his own health app and his own software to make it easier for doctors and nurses to give care to patients. Hello, Saul.
Hi, Toby.
Firstly, what's your problem? Why are you trying to make doctors and nurses' lives easier? And why are you trying to give people access to low-cost healthcare? What's wrong with you, man?
Well, you're born, you die, you got to do something in between.
There you go.
Yeah, so this seems to be a productive way to spend some time.
So tell us the backstory. As it happens, I know Saul because we have a mutual friend. So I really like the story of how you came to set up Kenna Health.
It wasn't in the long-term plan. I just ended up in healthcare by chance. I started another healthcare business with a few people in the mid-2000s. We were recruiting doctors from all around the world to work in rural government hospitals, mostly in South Africa. And over the course of a decade, we placed over 4,000 doctors, and they served over 30 million people. So I learned a lot about healthcare during that time, but was also quite frustrated because although we've got this massive shortage of doctors and healthcare workers, trying to move them physically to places where they don't generally want to go was a very laborious and time-consuming exercise. And so, leaving that business eventually, I started thinking about, well, how do we make these skills available more easily, more readily, at lower cost through technology, and make sure they get to people not when they're so sick they've got to go to the hospital, but a lot earlier.
Yes, preventative.
Preventative or catching things that will become serious later really early, primary care.
Great. Those are the big words I should have known to say, primary care. But you've really found a new way to do things, which I think is really impressive. And you yourself are not a doctor.
No, I'm not a doctor. And that's why I wouldn't use the word "you've found." I'd say it's a "we," definitely.
Okay.
I work with
humble and refuses to take credit as well.
Well, I'm not. Yeah, I mean, there's a lot of clinical work obviously that goes into this. I've got an amazing team of clinicians and engineers and designers, and really this has been a product of a lot of people's thinking over and iterations over a long period of time. But yeah, I mean, I've got a background in finance and machine learning. And as I say, just happened upon healthcare. And it's just, I like solving problems, and there's no harder problem than the healthcare problem.
Exactly.
Healthcare is a strange one because it's unlike any other sector. The more you pay, the less you get. Like there's nowhere you go and you pay more for a car and you get less car. But in healthcare, the more you pay, the less you get at a system level. So if you think about it, you go to an obstetrician to look after you when you're pregnant.
Yeah.
Not you, I hope.
No, well, yes.
But you pay the obstetrician specialist rates. But the stuff they're doing is actually the work that a midwife could do at a fraction of the price.
Yes.
So you're paying more. And then at the end of the day, when you need to give birth, the obstetrician is trained to do cesarean sections. And so they see a round hole, and they've got it. Everything therefore must be a round peg, and they will give you a cesarean section much more of the time than you actually need to. So that's a classic example of where you're paying more, but you're actually getting less.
Yes. It's such an interesting way of summing it up, Saul, because it is my experience. Our mutual friend actually is a specialist physician. So I've become very aware of not just the lives of GPs, but the lives of the specialists and how they work and what they do. And it's been a very interesting insight into how much more difficult their job is and how much more difficult it is for that kind of specialist to give care to all South Africans because of so many other reasons.
Absolutely.
And anyone who can find a easier path, less friction in a system that is so filled with friction as it is a great solution to a problem. And it's not just here in South Africa, it's across the continent and it's around the world. These are the same problems we face as a species wherever we are.
Absolutely. Healthcare in South Africa is actually most similar to healthcare in America.
Okay.
On the private sector side, pure play private. And in a pure play private sector, like in America and South Africa, we've got a slightly different problem to other countries in the world who also struggle to get healthcare to people who need it the most. And that is, in a private sector that pays for services delivered, the incentive is to deliver as much service as possible,
Yes.
rather than doing what's best for the patient.
Yes.
And that actually, not only do we have this problem that you're getting more and paying less because of going to the wrong person, but you actually end up paying more and getting less because there's a whole lot of unnecessary things happening, because how else does that clinician make a living? They are paid per consultation.
Yeah.
And even if they think they're doing the right thing, they might just be tending towards asking, for example, for a test that may not be necessary, or a return consultation that might not be necessary in a different environment, because they need that income. And also because when they only make money when people come to them, they're hesitant to refer you on to a nurse for basic healthcare, because they lose contact with you, they lose contact with your medical information, and they lose contact with you for follow-up. And so the system is now set up under a fee-for-service model to do more work, and
Yes.
also to not share patients to where they should go.
And you found a way to make accessing the information about the patients more efficient, because, as I understand it, you can free up the more highly paid workers at the top of a pyramid for the less well paid workers at the bottom, but no less competent, so that the specialist is doing more specialist things.
Yes, I mean, we'd love to get to the point where we're working with specialist physicians like our mutual friend, who then would deal with only the very specialized issues that require his kind of training and experience. What we've done is we managed to do it to some extent at a primary care level.
Okay.
So what that means is that where you would normally go to the GP, I've got two companies actually. It's Kenna and Health Force that I'm running. Let's speak about Kenna more specifically.
Yes.
But Kenna, you can go onto our app on your phone. In 60 seconds, you're registered. And what you do is you speak to a nurse first. And the nurse gathers a bunch of data, and the technology supports the nurse and the patient to gather data, so that by the time you get to the doctor can do a very quick consultation, because everything the doctor needs is available.
Exactly.
Which brings down the cost. Or actually what we're finding in 80% of the cases, the nurse actually ends up caring for you without the need of the doctor, which actually makes it a fraction of the cost.
Yeah, absolutely. I mean, my sister is a nurse. She's become a nurse practitioner. She lives in the States,
cool.
so she's technically a doctor. But, I mean, my whole life, we were so chuffed because we used to call her a sister with a capital S. So I know about the lives of nurses. I've always been conscientized to it. And I know that they are the backbone of the medical system, of the healthcare system. They hold people's hands at night. They are there when people are, their patient, their family couldn't be there during COVID. They are really important, and they have a lot of knowledge and a lot of information. And it makes perfect sense that they would be primary care if they can help it, and only if they can't solve it, then they go to the doctor. I mean, it's simple logic, isn't it?
Yes, I mean, you can see this very clearly in a hospital. It is used well, like nurses do a lot in hospitals. But as soon as you step out of the hospital environment, nurses are underutilized.
Yes.
On my other business, Health Force, we've built a piece of software that nurses use in clinics. Like at the back of a pharmacy. If you go to any discount, we're there. You go to the back, there's a really well-trained nurse. She's using our technology, or he's using our technology. And when we started out, these nurses were doing very little. They were doing maybe vitality health checks or weighing babies, where they've been trained to do proper primary care work. And this technology and our support has now got them up to top of scope. So now we are trying to utilize them fully. But also, when the nurse is something out of her scope, she can't prescribe medication, or there's a diagnosis she can't make, she can click a button, and without having made a booking, 3 minutes later, one of our doctors will appear on a flat screen in the clinic room.
Yeah.
And the doctor can see the nurse and patient, and then support the nurse to get a prescription or a referral letter or a sick note.
See, so now I'm interested in your back end.
Yes.
I'm not sure everybody else is, but I want to know how you do that. You have people on call. You have, I mean, you've obviously taken the physical system and digitized it.
Absolutely. So the back end is actually where our real intellectual property sits. And the back end can be defined.
Well, you may have just cracked a smile there,
I mean, people look at our app, and really our app our Kenna app is lovely. It's got a great rating, 4.8 out of 5 stars in the App Store and blah, blah, blah. We actually won the MTN App of the Year last year. We beat
I was very chuffed for
Pick
you
and Pay,
guys.
ASAP, we beat Discovery Bank, we beat Time Bank, beat all these guys. So it's a really beautiful app, but anyone can look at that app and copy it. It's the magic on the back end that we're really trying to solve the healthcare problem. So in the back end, like one piece of the back end is a sophisticated electronic medical record where we can share the healthcare information about the patient between the nurse, the doctor, and in fact on Kenna we do mental health as well. So you get a mental and physical view of the patient. And that allows us to easily hand off during a consultation. So when the nurse gets to the point where she can't do something and she needs the doctor can, there's a process in the back end where that's facilitated. Mental health, the same thing. So it allows for that. But it also allows when our clinicians answer the call, whether you saw that clinician previously or not, they can pick up the consultation from where you last left off with us. So if you've been to us previously, we can see those notes. They're summarized in a way where we can actually have a really clear view of your medical history, even though you've seen essentially a new doctor. That's a big piece of our back end.
I mean, can I just stop and say that's pretty remarkable? Like, that's the dream. That's exactly what everyone who talks to me about medical software and medical, that's what people want. And if you've got it working, well done.
Yeah, you say we've got it working. I want to say, no, we haven't, but I can see so much that still needs to happen. But we're able to facilitate consultations in such a way at the moment that in Kenna, we're lowering the cost by 70% from your local GP and Health Force by about 50%. So it's doing well enough for now. Another big piece of the back end is actually just getting the clinicians to work together.
Yeah.
In environments, as I mentioned, in a fee-for-service environment where the GPs are isolated, they're working by themselves, they build a practice, they earn an income from those people. They're not used to working in teams with other doctors. They're not used to working in teams with nurses in this sort of environment. And so we really hire for clinicians that want that team experience, want to ask other doctors for opinion, want to empower the nurse to do more and involve nurses in the consultation. So not only
it's a no-brainer to me.
Yes.
I have insight into the back end of how hospitals work because my sister was a nurse and I have friends who doctors and work in and I had another late friend who was she was an ER nurse. So I've heard amazing how, and I've always thought nurses are just extraordinary. Nurses, doctors, teachers. Sometimes they throw journalists into it. Us people who don't earn good salaries but do important work.
Exactly.
But I think it's great. Like, we're talking about knowledge. People know things. They know how to do things. The more we can empower those people, because they became nurses because they give a stuff for.
They do.
People.
So that's exactly it. I mean, it's interesting to see how nurses and doctors, for quite different reasons, love working on our platforms. For nurses, it's a case of like, people are coming in, I know I can help them to this level, but what if they need slightly more? Now I've got access to this doctor skill. So now I'm essentially a nurse with doctor skills, and I can call that doctor in when needed to get the additional skills I need. Now I can care for people on a much wider range of issues, and that's an advantage for me. And nurses love that. They also really love working with the doctors because of the way our doctors work with them. They will train the nurses up in the consultation, not belittling them, but saying, nurse, have you thought about this and this and next thing? And next time the nurse says, when a patient comes in with the same condition, they don't even call the doctor because now they know how to handle it. The doctors, on the other hand, love working with us because now they're not stuck in a practice in Bryanston or in Dunkeld seeing colds and flu in that local area. The first call might be someone from Dunkeld, but the second call could be someone with HIV in Eastern Cape, and the next call could be an old man with a skin condition in rural Limpopo. So the range of things they see is amazing. They work with a team for the first time. We've got a lot of working mothers that work with us, so it's flexible hours. And then there's this thing of that they don't have to build a practice. We have the practice. They don't have to build that. They can come to us and they can just be doctors.
Yeah.
They don't have to market themselves.
You see, now that really appeals to me because for years I've railed against this thing where people say artists need to be businessmen. No, artists must be artists. Mm. That's their job. They have to reflect society, etc., etc. I always thought the Medicis and the patron concept was right. The same thing. Doctors are doctors. If they were going to be businessmen, they would have gone to business school, not medical school.
Yes, we allow you to focus on that. That having been said, I really do think that doctors' training should include business courses, because while we can give that opportunity, there's still situations where doctors with their clinical knowledge end up running hospitals or their own practices.
Look, I don't disagree, but
Yeah.
the chances are they end up taking on so much debt and so much else. They have to become financially savvy if they can remember all the bones of the hand. I have something of a confession to make, Saul. That I was looking through my email last night to see when I first heard about you.
Yeah.
And I've got the first press release from you in 2020, I think, or 2022.
Yeah.
And my policy is I don't write about people who say they're going to do something or interview people. I do that about people who've done something. And I've waited and watched. And I instantly saw that you had a good idea, but I just have to wait until it works before I can write it. And I have to say, I'm glad I've waited because your success so far is really admirable. You deserve to win the App of the Year. Apart from partnering with a huge chain like Dis-Chem, you've also got a significant investment from Old Mutual's Next 175. And when I interviewed the CEO of that business, and he spoke so highly of Kenna Health, and I thought, you totally deserve this credit. So if no one else has said it to you, if no Boba has said, well done, my boy, here I am saying, well done, my boy.
I wish I still had my Boba. I mean, that's generous of you. Thanks, Toby. But I think that we haven't done much yet. Sad to tell you. Maybe I need to cancel this podcast.
Don't worry. I'll check in 2 years.
I mean, it's great that MTN saw the value in this. I think people understand something like this is needed in the world. And I think we have built something that works really well. But it's not really what we're doing it for. And I mean, it's nice to be recognized as an organization, but again, not the reason we're doing it. I mean, I really have a team of people that come to work every day because the family members have died or been in very bad situations as a result of poor healthcare. They love humanity. They want to do something good for humanity. There's a space where they can solve problems. But we, as yet, really haven't unlocked a major piece of what we do, which is figuring out how to get millions of people to use us rather than the thousands that are using us at the moment. And that's a problem that every healthcare product faces. You build something people need.
A problem every company and startup faces.
Demand side. Like, how do you get people to actually adopt a new way of doing things?
I've got this great friend from Varsity who, we're good friends. We don't really see much of each other. His advice to actors and whoever comes on set to do something is he says, you're the talent, show up and be good. And I just love that advice. And I often, it's kind of what I want to say to you as a business owner or a startup owner. I mean, I'm also a business owner and a startup owner. And that's the advice I give myself. Show up and be good. And I think you do that, Saul. You've moved the needle. I'm sorry to be the one to tell you that. And I'm glad that you don't think you've got to the zone. And from what I know about you, you do have this as your nature. So whatever you do, don't feel like you've achieved anything.
No, I mean, I think we're on the right path. I think we're doing the right thing. I think we're probably set up to move the needle significantly better than anybody doing this particular thing right now. Look, you mentioned Next 176 and Old Mutual. Like, this is why we're seeking out investors like that. We could have taken money from a number of different people, but Old Mutual has ambitions to do big things in healthcare for people who can't have access. And they've invested in us, and that gives us doors now to, as I say, the problem is customer acquisition.
I said that to Vuyo, the CEO. Like, you putting your name to this is like half of the investment. Like, it's not just the money; it's a big institutional investor that's looking to the future, that sees its role changing, that is investing in funds of this nature. You know, that's a great like stamp of approval.
It is.
You know? Better than a Jewish boba, maybe.
Yeah, well, it's practically for the business, it's a lot better. And actually, we've just launched with ShopRite as well. I don't know if you've seen.
I did.
Just Checkers, we're now with Checkers branding out in the market. Checkers is going and saying, like, this is the trusted healthcare app. And they're kind of promoting this to their customers to say, use it and try it out. So that's pretty cool. So again, that gives us credibility, and it gives us access to people that who wouldn't otherwise reach. And we've got a few other like big guys in the background that we're hoping to launch with soon as well. So this thing where I say we're not moving the needle yet, I think we've got good enough product now. There's one thing I really want to add.
No, I want you to feel like an underachiever and that you haven't got to your goal. I mean,
that I'm comfortable, but the way I do feel like I'm underachieving is I think we need to get this out there. And I mean, the best thing to do is just, and somehow I need to get people to just try it. Because once they've tried it, they realize how much you can do over an app. People don't know.
You're giving people information to make informed decisions, better decisions.
Yes.
You know, we're doing it in a slightly different way. We're just trying to help people save money and make their lives better.
Yeah.
Turns out it's what you're doing, you know.
Yeah, I mean, journalism plays such a critical role in that. I mean, at a system level, what we're trying to do is, like, you want to look at it from a national level. There's 60 million South Africans, and only 9 million can afford access to private care. That means 50 million people are going to government facilities. I worked with government for 10 years when I was doing that placement business. And I can tell you now that there are pockets of people trying to prop it up, but they're short of money, resources, management, and all sorts of things. So it's really poor quality of care in most of the situations. So why don't they go to private? It's just too expensive. And that's essentially what you're trying to solve. Like, how do we make this thing cheap enough that not 9, but 19, 29, 30, 59 million South Africans can afford it? And it's actually better quality than what you would have otherwise gone. So the 9 million that even pay for private care might even start using us as well. So yeah, it is that idea of like, if the journalist can't afford the $5, how do we still make sure the journalist is protected? If the citizen of this country can't afford the GP consult, how do we still get it to them?
Exactly. The big word in the startup scene is scale. And I really believe Kenna Health has a system and a backend, and it's the thought process. What makes a startup work? It's not just a good idea. It's a good idea with a good business plan. And I think you've got that. Yeah. I'm sorry to be the one to tell you that I think you've got a good product, and
sad face.
In 2 years' time, when I check in with you, I want to see
that's what we hope
what else you've done.
Yeah, we'll get there, and I think we do. I think we're on the right track, and I think if it's going to succeed, we're most likely to succeed, and we've seen it succeed in other places. So, yeah, I think we just got to. There's something in the way we're approaching it that has created what we've created to date that we need to double down on. And I think that'll get us there.
And that's why I think you're going to succeed. The
you.
way you spoke, what you said, how you said it, and that I know from the last few years of watching our rugrats run around with each other, that you really are this genuine. So thank you, Saul Kornik, on behalf of
Toby
the millions
Shapshak.
of other people who are going to get your service. You've been listening to the Stuff Podcast. Thank you very much for joining us. And thank you to Saul Kornik from Kenna Health. And good luck with your journey. In 2 years' time, we're going to check in.
Yeah.
Please like and subscribe wherever you get your podcasts, because it really does help. Our executive producer is Sally Hudson. Our director of audio is Hans Baumgarten. Our videographer is Tepo Tale, and you can read more every day on stuff.co.za. Thanks for listening.